Evening and welcome back. So we see a fine example of doublespeak where it's politically expedient. However, in this example, they do actually raise some valid points. And so it leads you to wonder as to why they can't say these when it might be a political enemy, seeing as the BBC is publicly funded. But nonetheless, let's dive in. So as they say, coronavirus, Scotland sees biggest daily rise in cases in almost a month. Ordinarily, as we're saying, it really shouldn't be an issue because COVID-19 isn't a problem whatsoever anyway. And in Scotland, of course, they've been saying that England has been too relaxed about things, in which case they're doing things on a much tighter regime, and therefore people aren't going out as much, they aren't allowed to socialise or interact nearly as much as south of the border. They're trying to enact some sort of harder border because of that and not allow people in from England, in which case you would expect them to be faring a lot better than England. However, as we see here, highest case numbers in almost a month. But you can see anything with statistics, so what's their pushback from this? They say that the Scottish Government said 21 cases have been detected in the last 24 hours, 8 of them within NHS Greater Glasgow and Clyde. It is the biggest daily increase since 21st of June, so all but 3 days. However, Scotland's National Clinical Director, Jason Leach, said he expected to see a day-to-day variation in the number of new cases, which is an easy out, for lower numbers at least. In addition to the Glasgow and Clyde cases, there were 5 new cases in NHS Lothian, with the rest spread around 7 other health boards. So as he says, Mr. Leach told BBC Scotland he did not believe the new cases were part of a cluster. I expect day-to-day variation, and the next thing I look at is the spread around the country, he said. So 21 in one small town would worry me much more than 21 spread around the country, and these 21 are spread around the country. Okay. So, low number, spread around, not an issue. You don't have to do a local lockdown because everybody's pretty much affected. Almost as if then doing things differently in different places doesn't have any effect whatsoever. But that's not the point they wish to hammer home. So day-to-day variation, that's to be expected. Okay, and why is that variation expected? Given that it's supposed to be so predictable and we know that the lockdowns would have a expectable result. So, he said he was confident in Scotland's test and protect system, and also pointed out that about 16,500 tests have been carried out on Friday, and so a rise in the number of positive results could also be expected. And that is really the key point, that yes, if you test more people, you're going to get more positive results, for about 3 reasons. One, the most obvious, is false positives, that you're going to get people who are being told that they have it when they don't, which is fine, unless of course they think it's a death sentence, and then decide to just sell everything and live life on the edge, and then come back realizing that they don't have it or it's not a death sentence, and then wish to sue their doctor, like we've seen in America with terminal cancer diagnoses, for example. So that's the false positive way. The second is that they're asymptomatic. People have it, they don't realize they have it, it's not causing any harm, nobody's getting hurt. They get tested anyway, and then they're told, oh, you have it. So, oh, wow. What are my symptoms? You don't have any. Okay, so I'm going to get them? No. So is this going to affect me at all? No. So, well, thanks for that then. Guess I'll just continue as I was doing. No, you can't do that either, because now you're positive. Probably. You might not be. And if we're talking about such small numbers from 16,500, it's getting to the point where it's more likely it's a false positive instead. And then thirdly, what if the positive result is the false positive because it's testing one of the other couple of dozen coronaviruses that they've had previously? So not antigens, but antibodies. And there might still be some antigens there, but it's the antibodies in particular that are still being able to attack the virus, and this kind of thing would be similar to the coronavirus, and that it would be just like the common cold, and I suppose similarly lethal, by which I mean not at all, but that would be picked up instead. So any of those instances would see a rise in the amount of people who have been diagnosed with COVID-19 despite it not being any issue whatsoever. So it really does lead you to wonder that when they've got particular places that they don't like, ordinarily it'll be cities or states in America, and they're trying to put it down to maybe Independence Day celebrations instead of the Black Lives Matter protests, for example, or Labor Day, then they're going to say we're seeing an uptick in cases because of these things and not because of the protests either. But then when it comes to somewhere that they like, then they're going to say, oh no, it's understandable we'll see an uptick in cases because that's just how these things go. Like, you know, those things that we've tried to discredit that our political enemies have been saying, that's the reason why. So we're going to use the same talking points, but when we say it, you can trust us, but when they say it, you can't. So as they say, the percentage of tests coming back positive remains low in Scotland and has been under 1% since the end of May, which is about the false positive rate as well. So, results you can't trust. Thank you, Scotland. The World Health Organization says that one measure which can indicate whether an epidemic is under control is whether, with a comprehensive testing system, less than 5% of samples return a positive for COVID-19 over 2 weeks. So, what do they say is comprehensive? It really depends, and these things are impossible to quantify, so it's just whatever you find expedient at the time. And no new deaths were registered in Scotland following a positive test for the virus, meaning that only one death in the last 10 days has been recorded using this measure. But I suppose it depends what requirements there are in order to record that as a COVID-19 death. The number of patients in hospital with confirmed COVID-19 fell from 316 to 305, with just 3 of them in intensive care units. Does that mean they've cut their funding down? Because that was the main reason that they wanted to go there before. But nonetheless, at least this is good news. And it's good news in 2 ways. One is such few cases that normality can return soon. And secondly, is they've expressed in a politically favourable way, one that is favourable by the legacy media as well, a way to explain away an uptick in cases. And you can say, in fact, you can quote the BBC or Scottish health ministers. In fact, the particular person in question saying Scotland's National Clinical Director Jason Leach, you can say that you'd expect a day-to-day variation, of course, and they're spread around the country, so that's perfectly fine, and that you've had more tests, so of course you'll get more positive results. You can quote them because that they are apparently okay things to say, and mention, of course, where it's from. But either way, whether they wish to be consistent, which of course they don't, or whether they just wish to cherry pick, which of course they do, at least we know, as anybody looking at this objectively, that it is coming down now. And if they're at least willing to admit that, then you've got to follow up by saying that the restrictions on freedom also have to ease up soon as well. And as I said before, with the idea of 24th of July onwards, £100 fine if you're not wearing a mask in a shop, I think that time delay was put in place so that they had time to renege on it, cancel, and say, we don't actually need to do this, because of new evidence that had come out, by which they mean we've realised you don't want it to happen, and therefore we've just cherry-picked data so that we can still seem to be honest. So let's hope for that. But until then, as always, have a good one.